good evening. So I'm Noel, your doctor for today. So may I know your name, sir? Your birthday?
February 20,
Okay, so
1960.
Mr. Elmer, so I am here tasked to do an abdominal physical examination. So may I ask you to sign this? Is it okay for you? Okay, so may I ask you to sign this if you have agreed and you are going to follow my instructions. Okay, thank you. So now may I ask you to lie down, sir? I could start my examination. Okay, I'm gonna place the patient in supine and gonna put one pillow on the head and one pillow under the knee. Okay. So drape the patient. And raise the shirt of the patient. Okay, raise that, sir. So first is to do an inspection. So inspect for a color, so bruises, erythema. Okay, so jaundice. Note for any strays, dilated veins, rashes, okay, any abnormalities. So the contours of the abdomen like that. So next is to do an auscultation. So our sequence for today is inspection, auscultation, percussion, and palpation. So percussion and palpation will go last since this would alter the our assessments. Okay. So next is after inspection, you do auscultation. So using the diaphragm of your stethoscope. Okay, listen to all of the quadrants. So you also need to listen for the bruits and if there is friction rubs. So your bruits are brought to you by, for example, atherosclerotic plaques in your vessels. So this would cause your bruits, and also a friction rub if there is, for example, a hepatoma, gonococcal infections. Okay. So normally your sounds consist of your gurgles and clicks, usually 5 to 34 per minute. And usually you could also hear, sometimes you could also hear stomach growling or your borborygmi. Okay, so normoactive bowel sounds for sure. Next is to do a percussion. So you percuss in all quadrants. So using your flexor motion. Okay. So usually it's tympanitic on the left and dull on the right due to the liver. Okay, so after that is to do a light palpation. So light palpation, so using your hand, so it should be horizontal plane at approximate horizontal, and with your fingers, so in all quadrants you palpate. Okay, you need to ask the patient to deep breath. Okay, take a deep breath, sir. Okay, you can also distract your patient by using you converse with him so that you can also observe if there is guarding, rigidity, and any response to pain as you palpate. Next is to do a deep palpation using your both hands. Okay, so one over the other. So deep palpation, same technique. So you palpate if there is masses. Okay, so normal. So next is to do a liver to check for the liver span. So by doing that, you need to do percussion. So for the lower border of the liver, so you're gonna percuss just below the level of your umbilicus at the right midclavicular line, and percussing upwards so that you can determine them. Okay. So next is to locate for the superior border of the gland. So starting at the nipple line and the right midclavicular line also. So from how you call this? Resonance to dullness. Okay. So next is to measure. Usually So it is 7 centimeters approximation. So that's normal. Next is to palpate for the liver edge. So left hand under the patient and then in the 11 to 12 rib, and you'll use this as a lift as you palpate for the liver edge. Yeah. Inhale, exhale, sir. So, okay. So, usually the liver edge is smooth, sharp, and the surface is smooth. Okay. So, next is to do an assessment on your, for the obese patient. So, this technique is very helpful. This is called your hooking technique. So, you stand at the right side of the chest of the patient, and you, with your hand side by side, you do a hooking like technique, hooking grasp of your liver. Okay. That so that you could feel for the liver edge. So inhale, exhale, sir. Okay. Okay, thank you. So next is to assess. We will now assess for your urinary bladder, sir, for the dome. So percussion first. So usually your bladder is non-palpable unless it is above the the symphysis pubis. So it is palpable when there is 400 to 600 ml of urine. Okay, so percussion starting at your umbilicus towards your hypogastric area, percussing downward. So usually tympanitic to dullness. Okay, so next is to do a palpation. So usually the is round, the dome, round and soft. Okay, so next is to do an assessment on your kidney. So at the you need to put your left hand back of the patient at the 12th rib. So we apply pressure. You lift this and you apply pressure on your right hand. Okay. This is how you do for the right kidney. Okay, sir, inhale, exhale. Okay, so next. So now let's go to the left kidney. Same procedure. Okay, sir, inhale, exhale. Okay. So next is to assess for, so if there is a positive pain or tenderness as you palpate the kidney, so you will proceed for the how do you call this, a percussion tenderness on the kidney. So let's just leave that to later, so that since the patient is supine, so that we will not change our positioning of the patient. So now let's proceed to assessing for appendicitis. Your appendicitis is the common cause of abdominal pain. So usually it's in the right lower quadrant. So these are how you assess it. So first is to ask the patient where the pain began first, then where is the pain now, and you let the patient cough so that you can determine the pain. Okay, the pain area, tender area. So, sir, are there any pain? Okay, wala. So the nature of our appendicitis, usually the pain begins at your umbilicus, running towards your right lower quadrant. And so first sign is to do a Robsing sign, so that is for rebound tenderness. Okay, so you apply pressure in the right lower quadrant, and you quickly withdraw the pressure. There is pain on the right lower quadrant. Wala. So that's negative. So next is to do a psoas sign. So apply pressure on the knee. Okay. So let the patient try to lift his knee. Sir, isa ka imong. Okay. So walay pain. Okay. So that's negative. So usually the positive for that is due to you can feel the pain. So the patient can feel pain due to the irritation of your psoas muscle brought to you by the inflamed appendix. So next is to do the obturator sign. So lift this is a passive technique. So you are gonna do the internal rotation of the hip and not the patient. Okay, so relax. So do you feel pain? Wala. Okay, so that's good. So usually, same mechanism with your psoas sign. So it is brought by the your irritation of your obturator muscle is due to the inflamed appendix. Okay, so next is there is a rectal exam and for the men, and also pelvic examination for women, which is less sensitive and less specific for appendicitis. But usually if there is positive pain on the right rectal tenderness, or there is right rectal tenderness, so that is positive for it. So if there is a positive psoas sign, positive Rosing signs, positive for obturator sign, so that is twice likely there is an appendicitis. So if you have assessed that there is positive tenderness in your McBurney's point, so usually it is 1 centimeter above your ASIC, your anterior superior iliac spine, and if there is tenderness there, so that is positive for McBurney's point. So that is 3 times likely you have appendicitis. Okay, so next is for our acute cholecystitis. So there is pain in the right upper quadrant and tenderness. So this is how you assess for Murphy's sign. So as you hook your left thumb or your right hand under the costal margin at the point of where the lateral rectus intersects with your costal margin. So now you're gonna apply pressure. So usually it is positive as the patient inhales. There is pain. So during inspiration there is pain. So as the patient inhales, so that is, it brings down the cholecystite, your gallbladder. Your gallbladder. Then if you can palpate for that, then usually it is sharp pain. So wala. Okay, so negative. So next, sir, may I ask you to sit down so that I could assess for your percussion tenderness of your kidneys. Okay. So usually, as I have said earlier, if there is tenderness on your palpation, your kidneys, so you need to proceed for percussion tenderness. So this is when you place the ball of one hand on this costovertebral angle, and you strike it with the ulnar surface of your fist. So that, if positive for that, is if there is pain felt, so that is suggestive for pyelonephritis or infection. Okay. Is there pain, sir? No. Okay, so that's negative. So I am done with my assessment, sir. So your abdomen is good. So no tenderness. Okay, no. And the contour is good. No abnormalities I have inspected. Your liver span is 7 centimeters, which is good also. And no hepatosplenomegaly, so no enlarged organs. So I haven't palpated for I was not able to palpate your kidneys and your skin. And no costovertebral angle tenderness also. So thank you, sir, for doing a great job today. Have a great day.